Welcome to the 2012 City of Austin Open Enrollment Video on Demand. My name is Mark Washington and I'm the Director of Human Resources and Civil Service for the City of Austin. I would like to introduce this series of videos on behalf of the Employee Benefit Division in my department. As you may be aware, open enrollment begins October 17, 2011 and ends on November 18, 2011. This is the only time of the year that many of us have to make changes to our benefit elections outside of qualifying events, changing flextra deductions, increasing life insurance amounts, or switching from medical coverage from the HMO to PPO or from PPO to HMO are just some of the changes that employees will be able to make during open enrollment. In 2010, the city spent a sizable amount in the investment of our employees in health care benefits. Over $121 million in the face of rising health care costs was invested on your behalf by the City of Austin. Recognizing that Austin is not the only agency across the country and the state that's experiencing health care inflation. Many other agencies have double-digit health insurance increases and are making significant changes to their plan designs. In light of that, the City of Austin has maintained a very competitive and affordable benefit plan for its employees by ensuring that health care increases were on average at the amount of about 8%. The city pays approximately $10,000 for each employee that is enrolled in the HMO plan, compared to approximately $8,600 for employees that are enrolled in the PPO plan. Recognizing this difference in cost and the fact that the HMO was costing far more than the PPO, the City of Austin increased the amount of the HMO an additional $2.50 per pay period in addition to the increase in premium, the 8% increase in premium. I encourage employees to participate in the Healthy Connections Wellness Program, which is designed to help employees live healthier lifestyles with the goal of lowering medical costs. Changes made during open enrollment become effective January 1, 2012, and the first premiums are deducted from your earnings on January 20th. The videos are intended to help make sometimes difficult choices and to help you make good decisions. Two employees have generously offered to help present the 2012 benefit plan overview. They are Sarah Hartley from the Public Works Department and Larry Schooler from the Public Information Office.
Hi, I'm Larry Schooler, and I'm going to help you navigate through the open enrollment process, which begins October 17, 2011 and ends November 18, 2011. Your individual 2011 Employee Coverage Information Statement and a copy of the 2012 Employee Benefits Guide have been delivered to your department. If you haven't received yours, please check with the enrollment coordinator in your department. Information on the 2012 benefits plan can also be found online at www.ci.austin.tx.us/benefits/enrollment or on CitySpace. If you're satisfied with your current benefit options and don't plan on making changes, you don't need to participate in open enrollment. Your current elections will automatically roll over for 2012. However, if you need to make changes after reviewing the 2012 materials, there are 3 different ways to participate. The online enrollment system begins October 17th and ends at midnight November 20th. Use your employee ID number, located on both your timesheet and your coverage statement, and the first 5 numbers of your Social Security number to access the online enrollment system. The telephone enrollment system lines are open between 8 a.m. and 5 p.m. Monday through Friday from the beginning of open enrollment through November 10th. Benefits enrollment forms are also available and can be completed with your department's open enrollment coordinator at your workplace. The 2012 rates for your current coverage are on your coverage information statement. You will also find the names of all dependents enrolled in benefits. If you find mistakes, such as an incorrect Social Security number or date of birth for a dependent, you must use the online system, telephonic system, or complete a benefits enrollment form to make the necessary corrections. If you were hired after September 10, 2011, you won't receive a coverage information statement and must complete a benefits enrollment form to make changes. If you complete the online or telephone system process, a confirmation statement is automatically mailed to your home address within 2 business days. Carefully review your elections. If you find a mistake in your coverage statement, you must repeat the open enrollment process or call CompuSys ERISA Group Incorporated to make corrections. If you don't receive a confirmation statement, it is likely your changes were not accepted, so you will need to repeat the process. Although this all sounds complicated, the online and telephone systems are quick and easy ways to complete the open enrollment process. It's also a way to include your family in the decision-making process, especially if you use the online system from your home computer. Open enrollment is also a great time to update your beneficiaries by completing a beneficiary designation form. However, you can update this document at any time during the year.
Hi, my name is Sarah Hartley, and I will be reviewing United Healthcare's 2012 PPO Medical Plan, also known as the United Healthcare Choice Plus Plan. I will touch on the changes for 2012, including copays, out-of-pocket amounts, and the advantages of the PPO plan. You can find more detailed information in the 2012 Benefits Guide. 2012 changes include copays for in-network diabetic counseling will be waived. My Nurse Line, activated in August 2011, will still be available. Primary care copays increase from $20 to $25. This includes optometrist visits. Emergency room copays will increase by $25 from $100 to $125. A $50 pharmacy deductible for Tier 2 and Tier 3 drugs will be introduced. PPO in-network coinsurance decreases from 85% to 80%. The 2012 PPO in-network plan benefits include a $25 copay for in-network primary care doctors and a $35 copay for in-network specialists. In-network minor lab and X-ray and preventative services are covered at 100%. There is no copay. Calendar year deductibles are $500 per individual, paid once per calendar year. For family, it's $500 per individual up to $1,500 per calendar year. The maximum out-of-pocket for individuals is $3,000. For inpatient hospital, you will pay $500 when you're admitted. The plan will pay 80% of the allowable charges, and you will pay 20% of the allowable charges, up to a maximum of $3,000. The plan will pay 100% of the remaining balance, up to the total allowed amount. Outpatient surgery is a $75 facility copay, the calendar year deductible, and the plan pays 80% for physician services. Major diagnostics such as MRI, CT, and PET scans is a $100 copay. Emergency room services are a $125 copay per visit. Urgent care services are a $35 copay. Acupuncture is also covered under the PPO with a $35 copay, and allergy services are covered at 100% after office visit copays. Prescription drugs. For Tier 2 and Tier 3 drugs, each member must meet a $50 annual deductible. After this deductible is met, these copays will apply. Tier 1 drugs are $10, Tier 2 are $30, and Tier 3 are $50. Mail order is available, and a 90-day supply is only 2 copays. With the PPO, you also have out-of-network benefits. Please refer to your Employee Benefits Guide for specifics of this coverage.
"2012 HMO benefit changes include primary care copays increase from $20 to $25. This includes optometrist visits. A $50 pharmacy deductible for Tier 2 and Tier 3 drugs is introduced. Emergency room copays increase by $25 from $150 to $175. Copays for diabetic counseling will be waived. My Nurse Line, activated in August, will still be available. Diabetes counseling will be offered at work sites. To enroll in the HMO, you must live or work in the service area, which is Bastrop, Blanco, Burnett, Caldwell, Hayes, Travis, and Williamson County. The HMO plan does not cover out-of-network benefits. This quick overview of the HMO plan details benefits services which are only available at in-network providers. For doctors, in-network benefits only, primary care is a $25 copay. Specialists are a $45 copay. That includes minor lab, X-ray, and preventative services covered at 100% with no copay. For the calendar year, the deductible for an individual is none, and for a family is none. For the maximum out-of-pocket expenses for an individual, it's $3,500, and for a family, it's $7,000. For an inpatient hospital visit, it's a $1,000 copay per confinement. For outpatient surgery, it's a $600 facility copay and a $45 specialist copay. For major diagnostic tests like an MRI, CT, or PET scan, it's a $100 copay. For emergency room services, it's a $175 copay. For urgent care services, a $45 copay. For convenience care clinics, a $25 copay. And for allergy, 50%. For prescription drugs, Tier 1 is a $10 copay. For Tier 2 and Tier 3 drugs, each member must meet a $50 annual deductible. After the deductible is met, these copays will apply. Tier 2, $35 copay. Tier 3, $55 copay. For mail order, a 90-day supply, no copay savings are offered under HMO mail order for that 90-day supply. Here's some other PPO and HMO information to remember. Urgent care flyers are available on the CitySpace website or by attending an open enrollment presentation. Pocket cards are available at open enrollment presentations or from your open enrollment coordinator. All employees will receive new ID cards. Vision benefits are still available under both the PPO and HMO medical plans. These include an exam benefit and a material discount available through the UHC Vision Plan. For more details on these plans, please see the side-by-side comparison of these two benefits in your Employee Benefits Guide to determine the best utilization of the Vision program for you and your family. Optometrists are considered primary care and a $25 copay is required.
The Dental Assistance Plan offered by the city allows you to choose your own dentist and provides you a solid level of dental care coverage for you and your family at a reasonable price. For preventative care, there is no deductible. Basic, major, and orthodontia are a $50 deductible per calendar year. The calendar year maximum is $1,800. Orthodontia lifetime maximum is also $1,800, and this amount is applied toward your calendar year maximum. There is no dental network. You can go to any dentist that you choose. There is a fixed fee reimbursement schedule, which is the maximum amount the plan will pay for dental expenses. For example, if your dentist charges $145 for a filling and the amount in the schedule is $114.56, your cost is $30.44. If this is the first time you've used the plan and haven't met your $58 annual deductible, your cost is $80.44.
Davis Vision is the city's vendor offering you and your dependents coverage for annual eye exams, glasses, or contacts. Davis Vision has a large network that consists of optometrists, ophthalmologists, as well as retail optical chain stores like iMasters, TSO, Walmart, and Sam's Club. To maximize the Davis Vision plan benefits, we urge you to use one of the many in-network providers in the area. To find a provider, go to Davis Vision's website or call customer service. Routine eye exams are very important and can detect a variety of medical conditions such as diabetes, high blood pressure, and glaucoma. Your vision plan will cover a comprehensive dilated eye examination each calendar year for a $10 copay. The plan also covers either eyeglasses or contact lenses each calendar year. For eyeglasses, you have the choice of choosing from the Davis Vision Designer Collection of frames at no cost to you. The Davis Vision Collection of frames is available at independent participating providers. Or Davis Vision will apply $125 towards the retail cost of a non-collection frame that the provider is selling. Just as a note, the Davis Vision retail providers such as iMasters, Walmart, and Sam's Club don't carry the Davis Vision collection of frames. You can select any frame from these locations and get $125 applied to the retail cost. There's a 20% discount off of any amount exceeding $125. For the frame lenses, your vision plan covers the standard lenses, such as single vision and line multifocal lenses, in full after a $25 copayment. In addition, your plan covers scratch coating and polycarbonate lenses for dependents up to age 19 at no additional cost. Davis Vision prides itself on having the lowest member out-of-pocket expenses in the industry. Lens options are not usually covered by most vision plans and would be an additional cost to the member. Davis Vision's in-network providers have fixed set prices on all lens options, which are printed on all member materials, so there are no surprises when you check out at the optical store. Examples of these lens options are UV coating, tints, or progressive lenses. Additional discounts are not available at Walmart or Sam's Club locations. If you are a contact lens wearer, Davis Vision's collection of contacts is covered in full after the $25 copay. These benefits also include the fitting and follow-up care. If your doctor prescribes contacts which are not part of the Davis Vision contact lens collection, they will apply $120 toward the retail cost of the contact lens and $60 toward the evaluation, fitting, and follow-up care fees after the $25 copay. In addition, you will get a 15% discount on amounts in excess of the allowance for contact lenses and the evaluation, fitting, and follow-up fees. When you first enroll in the Davis Vision Plan, you will receive an identification card. Call their customer service number if you need additional identification cards. Please remember that out-of-pocket vision expenses such as vision exam copays and amounts over the frame or contact lens allowances can be paid with your Flextra Benefits card through your Flextra Healthcare spending account.
The Texas Legal Protection Plan, or TLPP, is the city's vendor offering you and your dependents legal protection coverage. Most City of Austin employees or a family member will have had an issue requiring the help of a lawyer at some point in their career. Help such as reviewing a contract, determining fault resulting from property damage, obtaining a divorce, creating a will, adopting a child, or even advice on credit issues and identity theft can all be obtained by calling TLPP. Coverage can be elected for employee only or employee and family. Dependent children must be unmarried and under the age of 25. Premiums are paid through payroll deduction, and benefits begin immediately on the effective date of coverage, with the exception of divorce, separation, and annulment, where a 6-month waiting period is required. There are no co-pays or deductibles, and everything is confidential. Members of TLPP can choose from any participating attorneys throughout the state of Texas for assistance, but they can also use a non-participating attorney on an indemnity basis. This means you receive partial reimbursement for legal work based on a set fee structure. Please keep in mind the plan is not a license to sue, nor can it be used to take legal action against the City of Austin for any reason. Each of the following benefits is available through TLPP, one time per year per family. Action benefits include adoption court proceedings, bankruptcy court proceedings of a non-business nature, consumer protection, divorce, separation and annulment, estate planning including a will, power of attorney, living will, and codicil, habeas corpus court proceedings, and name change. Protection benefits include defense of a civil action, defense of a felony charge, defense of an insanity or infirmity proceeding, defense of a misdemeanor charge, defense of a misdemeanor license suspension, defense of a DWI, and juvenile court proceedings. TLPP offers an additional 4 hours of preventative legal services per plan year. This includes legal advice, correspondence, negotiation, and document preparation. Services outside the scope of TLPP's coverage can be accessed using this feature. TLPP also offers legal hotline services with unlimited toll-free telephone access to attorneys for general legal advice and consultation.
Deferred compensation, known as a 457B plan, is a tax-deferred retirement account designed for governmental employees. The account is designed to provide a supplement to pension benefits and help you grow a nest egg for retirement while employed with the city. The city's plan is currently administered by ING Institutional Plan Services, LLC. The contribution limits for deferred compensation are currently, if you're under the age of 50, you can contribute up to $16,500. If you're age 50 or older, you are eligible to contribute an additional $5,500 for a total contribution of $22,000. You may also be eligible for the standard catch-up provision, which allows individuals who are close to retirement to contribute more. This provision allows you to contribute double the regular limit for up to 3 consecutive years once you are within 3 years of retirement eligibility using the city's criteria. This amount is $33,000. If you were thinking of getting started in deferred compensation, the minimum contribution is just $10 or 1% of your salary per pay period, the equivalent of going out to lunch just 2 times a week. There are 3 ways you can enroll: by going online, by completing a form available from the local office, or by calling the ING Plan Information Line. You will need a personal identification number or PIN to enroll online. If you do not have a PIN, you can obtain one by calling us or by pressing the Forgot Your Password link on our website. Deferred compensation makes it easy to save for retirement with low initial contribution amounts and flexible contribution options, either a dollar amount or percentage of your pay. You are also eligible to change your contribution for any paycheck throughout the year. The money can be invested in a variety of options ranging from safer fixed investments through aggressive international mutual funds. The plan also offers a self-managed account through a partnership with Charles Schwab, which allows you to invest in any mutual fund available. There is an extra cost if you decide to use the self-managed account. In addition, you can also receive professional advice on your account through the Personal Online Advisor, Professional Account Manager, or by calling your local ING representatives. If you have money in a former employer's retirement plan or want to consolidate your retirement assets, you may also roll money from eligible 401k, 403b, traditional IRA, and other 457b plans into your deferred compensation plan. While employed, participants have access to their money through the loan program. Participants can take up to 2 loans and borrow up to half of your current account balance while also determining the payment schedule, anywhere from 1 to 5 years for a general purpose loan or 5 to 30 years for a residential loan. Loan repayments plus the interest of the loan are deposited back into the participant's account. The fee to take a loan is $50 and is deducted from the participant's account. Deferred compensation may also be used to purchase service credit with the city's pension system. Please contact your pension office for more information on how this works. In addition, participants can take money from their account at any age once they've separated service from the city without the usual 10% IRS penalty, an advantage other types of pre-tax retirement accounts such as 401k, 403b, or IRA don't offer. Participants only pay income tax on the money withdrawn each tax year. Contact a plan representative to schedule an individual consultation to enroll, review your account, or ask questions. Your local ING representatives are Will Cornforth and Mario Iniguez, and the local office is located at 10,900 Stone Lake Boulevard, Suite B150. Prior to making any investment decisions, you should carefully review all fund information. This presentation is for general education purposes only and does not, nor is it intended to constitute legal, tax, investment, or financial advice. To the extent that you need any such advice, you are encouraged to speak with your legal, tax, or investment advisor.
Basic life insurance is provided at no cost for full-time employees. You receive 1 times your base annual salary with a minimum coverage of $20,000. Part-time employees can purchase basic life insurance coverage at reasonable rates. Supplemental life insurance is paid entirely by you. If you want to add or increase your supplemental life insurance, open enrollment is your opportunity to do so. You can increase the amount of your supplemental life insurance up to 4 times your annual salary. For example, if you make $40,000 a year, you can purchase up to $160,000 in coverage. However, you can only increase coverage by 1 level per year. For example, if you currently do not have supplemental coverage, you could purchase an amount equal to 1 times your annual salary this year and up to 2 times your annual salary the next year. Your cost for supplemental life insurance is determined by your age and salary. To determine your cost per pay period, refer to the Supplemental Life Insurance worksheet in the guide. If you are a part-time employee working less than 30 hours per week, you must purchase basic life insurance to buy supplemental life insurance. For detailed information on the life insurance plan, including dependent life insurance, accidental death and dismemberment coverage, accelerated death benefits, and waiver of coverage, please refer to the Employee Benefits Guide. Dependent life insurance is available for your spouse, domestic partner, and children up to age 26. There are 2 options to choose from when purchasing coverage for your dependents. If you choose to enroll your dependents for coverage, you become the beneficiary under the plan. Open enrollment is also the time to increase your dependent life insurance from option 1 to option 2.
Short-term disability is provided at no cost to employees who work 20 or more hours per week. You can receive up to 70% of your base weekly salary for off-the-job injury, illness, or pregnancy if disabled once you're approved for the benefit. After you've been out of work for at least 30 consecutive days, you are eligible to receive payment for up to 60 days. The benefit is paid weekly, and short-term disability payments are considered taxable income. Long-term disability insurance is available to employees who work 20 or more hours per week. Your cost for the coverage is based on the number of hours you work per week and your annual salary. The long-term disability worksheet included in your benefits guide is an easy way to determine the cost per pay period. If disabled, you receive 60% of your base weekly salary for on or off-the-job injury, illness, or pregnancy once you have been approved for the benefit. You must be out of work for at least 90 consecutive days before you will begin receiving payment. If you meet the disability carrier's disability requirements, you can continue receiving payment until your disability ends or until you reach age 65. Long-term disability is not considered taxable income.
Flextra is a tax savings program offered by the City of Austin to help you increase the amount of money you take home each pay period. Money set aside in a Flextra account reduces your income so less federal income tax is withheld from your earnings. The City operates 2 Flextra spending accounts under IRS Code Section 125, one for health care and one for dependent care. You may choose to participate in one or both of these accounts. If you elect to participate in the City's Flextra health care account, allowable medical expenses include copays, coinsurance, prescription copays, glasses, hearing aids, vision materials, LASIK surgery, as well as over-the-counter drugs with a doctor's prescription. Examples of over-the-counter drugs eligible for reimbursement are allergy medicines, cold medicines, throat lozenges, nasal sinus sprays, Visine, pain relievers, cough drops, sinus medicine, and nicotine gum or patches. Please be reminded that you will need a prescription and must submit receipts and a claim form to ERISA for reimbursement. The maximum you can set aside is $250 per pay period. This money is loaded into a Flextra benefits account for you to use when paying for eligible expenses. Under the Flextra section of the guide, you will find a worksheet and a step-by-step process to help you estimate your Flextra healthcare expenses. You can't pay for insurance premiums, expenses reimbursed by another policy, vitamins, cosmetics, or expensive for non-IRS dependents using this money. You can enroll in Flextra as a new employee or when you experience an allowed IRS status change, such as adding or dropping a dependent, changing from temporary to permanent, or during open enrollment. When you enroll in Flextra, you cannot stop participating during the year and cannot change the amount you set aside unless there's an allowed IRS status change. Now we'll review the Flextra Dependent Care Account. This account you set aside pre-tax money for eligible dependent care expenses. You can get reimbursement for daycare expenses for children under age 13 and disabled dependents of any age spending at least 8 hours a day in your home. Claims can be submitted for babysitters or daycare centers as allowed by the IRS and must include either a Social Security or tax identification number. Relatives claimed as a dependent on you or your spouse's tax return or children and stepchildren under age 19 are not eligible providers. You can set aside up to $208 per pay period. You simply submit a receipt and a dependent care claim form to ERISA, who mails reimbursement checks every week. Use the step-by-step Flextra Dependent Care worksheet in the benefits guide to estimate your yearly expenses. Both Flextra options are use it or lose it accounts. Carefully estimate the money you put aside in your Flextra accounts. Money not claimed by the deadline will be lost. However, the IRS does allow you to continue to incur expenses through March 15th of the following year for health care or child care expenses. The deadline to submit these claims for reimbursement is May 31st of the following year. The City has many additional benefits available to employees. Healthy Connections, our award-winning wellness program, offers a wide array of wellness programming for employees. There is also an employee assistance program, tuition reimbursement, child care programs, free transit passes from our commuter program, and a Veterans Services Office helping employees transition from the military back to civilian life. For a complete listing of additional benefits, please refer to the 2012 Employee Benefits Guide.
You've just viewed video on demand for open enrollment. If you have any questions about the benefits options explained during these videos, please contact us during normal business hours Monday through Friday between 7:30 a.m. and 5 p.m. Thank you.